Good morning. If you're here for the Community Health Options educational webinar, you're in the right place. In a few minutes, we'll get started with understanding the value of your oral health. We'll just wait a few more minutes for everyone else to get ready, so just stand by. Good afternoon and welcome to Understanding the Value of Your Oral Health, presented by Northeast Delta Dental and Community Health Options. I will shortly turn over the controls to Sharon Ware, but I'm just going to cover a couple housekeeping items here. First is everyone is currently on mute just to keep the environmental noise down. Certainly, if you have a question, we'll take questions at the end. You can either type in your questions in the little chat feature, or you can raise your hand and we can unmute you and you can ask your question over the phone. Again, we're going to hold questions to the end of the webinar to ensure that we get through all of it. But if you do have a question in the middle of the presentation that you don't want to forget, feel free to type it in the chat box and we'll read them out at the end. The webinar is being recorded, and when it's done, it will be posted on the Health Options Employer website, where you can access it in about probably 3 to 4 business days. We'll get that up there for you. And if you want it sooner, or if you need follow-up information, feel free to contact Sharon's team and they're happy to help you. And I'm going to hand it over now to Sharon Ware. Okay, Sharon, take it away.
Great. Thank you, Caitlin, and welcome. Thank you for joining us this afternoon for your busy lunch hour. I'm hoping today's topic is a good one for everyone. But to introduce myself, I'm Sharon Weir, and on behalf of Community Health Options, I do want to welcome you. And again, thank you for joining. Community Health Options is a nonprofit, consumer-operated and oriented health plan that has been in operation since January of 2014. We are a health insurance company, and we're licensed in Maine and offering qualified health plans to consumers, both on and off the marketplace. And we also offer coverage to employers, and we help them navigate the sometimes complex waters of employee benefits. Today's topic is an important one, and our co-presenters from Northeast Delta Dental will be covering understanding the value of your oral health. And really, this presentation is designed to help promote good overall oral health, as well as just wellness in general. Our speakers will introduce themselves in just a moment, but before we get started, I do want to cover just a couple of items that Caitlin mentioned. As she mentioned, we will be taking comments, and you can place a comment by using the question box that appears in the dialogue menu ribbon on the right side of your screen. And so to navigate there and towards the top of the ribbon, you'll see a small orange arrow. If you just click on this arrow, you can expand or collapse the menu, and also put in your comments. We'll try to handle all questions at the end of the presentation. And as Caitlin said, the slide deck from today's webinar will be available to you as a registrant, and then we'll also be sharing the recorded file for this and all of our sessions on our website if you'd like to look at it at a later date. So thank you again for joining us. And at the moment, I'd like to pass the baton to Krista Ketty and Stacy Plord of Northeast Delta Dental, who will start our session today. And Caitlin will be handling the housekeeping and technical issues as we move forward through the webinar.
Thank you, Sharon and Caitlin. My name is Krista Ketty, and I am a dental hygienist who now works with Northeast Delta Dental to educate dental offices about our dental benefit plans and our Health Through Oral Wellness program, along with educating subscribers and consumers on the importance of going to the dentist and more overall your oral health. I have Stacy with me today, and we are going to be presenting together.
Hi everybody, I'm Stacy Plord. I am also a dental hygienist. I've been a dental hygienist going on 30 years this year, and I currently work at Northeast Delta Dental with Krista, and we go out to offices educating the dental providers as well as subscribers and the value of their oral health. So Krista, I'm wondering, why should I be concerned about my oral health? It is just my teeth and my gums. What's the big deal about?
I know, sometimes we forget that this small mouth is really the gateway to the rest of our body, and that poor oral health really affects the body in many negative ways. We all know a little bit about gum disease or the inflammation of the pink teeth in our mouth, or maybe we've heard the term of a cavity or tooth decay, a dental infection like an abscess. Those things can also cause pain in our mouth. But as an individual, we often forget how our mouth connects to our body and in other ways how it affects us. Another way it affects us is that tooth loss can lead to poor nutrition, which can potentially poor self-image. Really, that smile is the start of all of our conversations. A smile is really something we do every day, and if we or a person does not like their smile, it can also lead to maybe us not wanting to go in for that interview to get that job. So our mouth has an impact on our day-to-day lives. It also has an impact on our overall health. It does have a relationship to diabetes, along with increased risk of heart disease and strokes.
I guess I can really see how the mouth truly is the window to the rest of your body and how it can affect that. So, a little quiz, Krista. It's quiz time. So, which of the following general health problems have been linked to poor oral health? Is it A, diabetes, B, heart disease, C, stroke, or D, all of the above?
Ooh, let's see. We didn't waste any time to give this quiz. So hopefully you've thought about maybe what that answer is going to be. And let's go ahead and see. It is D, all of the above. So all of these three things, diabetes, heart disease, and stroke, have been linked to poor oral health.
So we talk about oral health and oral disease. Just what is oral disease? It can be as simple as a cavity, or as often we call it, caries. We sort of use these terms interchangeably. It can also be periodontal disease or gum disease, which has two different forms. There's gingivitis as well as periodontitis. As you can see, this is a little more severe than the gingivitis. There's also oral cancer, which is considered an oral disease, and we're going to talk about that a little bit in this presentation. It can also be your TMJ, or temporomandibular joint disease. So if you have pain or clicking upon opening of your jaw, that can be an oral disease as well. Oral disease can be the oral symptoms of systemic diseases. Krista just talked about some of the relationships between diabetes, heart disease, and stroke, and sometimes that will show up as an oral symptom in your mouth. And it can just be as simple as that canker sore or that cold sore that's on your lip. That's another form of an oral disease.
So what does that mean? It means that when you go to your dental office, they're looking at more things than just if you have a cavity on your tooth or if the gums are inflamed. They're also looking to see if there's symptoms or signs in the mouth that could possibly be related to an autoimmune disease. Oftentimes, autoimmune diseases first manifest themselves in their mouth. So sometimes the dental professionals, whether it be your dentist, dental hygienist, or dental assistant, who's diagnosing those things before your primary care physician. So whether you have no teeth, it's still important to visit the dentist because those things are still evaluated by your dental professionals and your dental office.
So it makes a lot of sense that if we disregard that cavity that's forming or that broken tooth that's in our mouth, it can lead to a lot of other implications that we may not make that relationship to, that it's going back to that cavity or that broken tooth.
So we're really going to go into some specific topics of oral disease today. The first topic we're going to go into is tooth decay. And I always like to start the topic with a little diagram or picture. And I just thought that this was perfect and a little bit of humor. So John has 32 candy bars, then he eats 18 candy bars. What does John have now, Stacy?
John is going to have cavities.
So let's take a look. Really, what is a dental cavity, Stacy?
So a dental cavity, or caries, is actually the most infectious disease in humans. And we often think of infections as being the cold or the flu, particularly this time of year. But dental caries is one of the most infectious disease in humans. As you can see here by these stats, that 75% of U.S. children will have had a cavity by age 18. And cavities just aren't for kids anymore. You can see here that 90% of young adults aged 24 to 35 are going to get a cavity. And, I thought, hey, since I happen to be a little older than Krista, that, hey, I'm getting older, I don't have to worry about cavities anymore. But
what we're finding is that actually adults are getting cavities more now because we have made so many advancements and so much education in the dental industry. We as adults are keeping our teeth longer than past generations have. So because we are keeping our teeth longer, adults are now getting more cavities. And the main reason adults are getting cavities is due to areas of gum recession in the mouth. So in this image you see on your screen, you can see the little yellow areas. That's where the gum levels have dropped, and the yellow areas are actually the root surface of the tooth. So the root surface of the tooth is not typically exposed to anytime you eat or any of the bacteria in the mouth, and the root surfaces are a lot softer than your really hard enamel. So what's happening is bacteria is getting on the root surfaces, or maybe it's because of adults taking medications that are causing dry mouth. So there's not so much saliva in the mouth that's really kind of swishing around and removing the plaque and removing the pathogens and that kind of food debris from the area. So it's staying on those root surfaces and it's causing what we call root caries. And in the dental industry, we call root caries and we say it spreads like wildfire. So what happens is once you get a cavity on one root surface, that bacteria is not going to be delayed in going to the next root surface that it can affect with a cavity.
And a lot of people do have recession. I know I do from having, orthodontic treatment and moving the teeth, as well as sort of clenching and grinding. So this is something that I need to be aware of. And, I went to the dentist today and actually had my teeth cleaned before coming and doing this presentation. And we did talk about this a little bit. Even as a hygienist, I have to be reminded of, hey, watch out for this area and be careful of what you're doing because you are more prone to those root caries or the root cavities. Cavities in kids, oftentimes we focus on kids, and Krista has a newborn, or well, not a newborn anymore, he's now
just turned 1.
So, we can talk about, we have to be concerned about our cavities in our children. And the studies have shown that if a child has tooth decay in a baby tooth, they're more likely to have tooth decay or a cavity in their adult teeth. I remember growing up or even having patients that would come in and they would say, oh, it's just a baby tooth, it's no big deal, it's just, they're going to lose a tooth, what does it matter? And it is a big deal because that's going to make them more prone to having that cavity or tooth decay in their adult teeth. And we also have another statistic that 55 million school hours are lost by children each year due to a dental-related illness. And I actually had the privilege to work in the schools and provide dental services to children. And this is a very true fact. There were many children that would go to the nurse's office with that dental pain or a toothache due to a cavity.
And the first bullet here where it says untreated dental caries affects growth and development kind of hits on that last bullet point of why school hours are lost. It affects growth and development because if the child needs to miss school, they're not in school learning that subject matter for that day and they're having to catch up. It could also affect the growth of the child because if they do have pain, they are not going to want to eat their normal diet, and therefore it can lead to poor nutrition in the child as well. So.
And it made me think of going back to that slide about untreated dental decay, and we had the picture of the gentleman that can lead to pain and things like that. This is something that can happen to people in the workplace. You know, not only are children missing, school hours, if you have dental pain or a dental related issue, you could be missing work hours due to that toothache or cavity.
So what does that mean? We want to go to the dentist before we feel pain, right, Stacey?
Correct. And bring your child to the dentist before age 1. Some of you might think this is crazy. How am I going to get a 6-month-old to the dentist? And let's, since yours is so little, tell us your experience with him going to the dentist.
So when I bring when he was 6 months old, when I brought MJ to the dentist, my dental hygienist did not go ahead and polish his teeth or remove plaque off of his teeth. My poor son barely opened his mouth for her. And that's actually okay. The American Dental Association is not recommending that the patient at age 6 months have their first dental cleaning. It's actually more of a discussion for the dental professional to discuss what the parent should be doing at home and what things the parent needs to monitor. Monitor above and beyond taking care of the teeth that are now erupting in that child's mouth. But what is the parent feeding the child that could be causing tooth decay? What is the parent doing at home as far as brushing the teeth? Maybe it's not that the parent can use a toothbrush yet, but maybe just getting the finger in there that has a washcloth on it just to help remove any of that bacteria. And then the next big thing that us as dental professionals are recommending to the parents is not to test the food in your mouth, being the parent, then putting it into the child's mouth. Because if you have had cavities or if you have bacteria in your mouth that's causing gum disease, you're passing that bacteria to the child, which makes them more prone to those dental infections.
Or maybe even, that pacifier or binky fell on the floor. I'm just going to clean it off in my mouth and put it back in my child's mouth. That would be something that's not recommended as well. I do have to say that one of the things that I did with my kids when they were little, you talk about the soft cloth and getting them used to having something in their mouth. If my child was in the high chair or bouncy seat or one of those objects that they would sit in, and obviously not something that's going to be jumping, not the jumper because that would be bad. I would give them a toothbrush because they're teething and they would just kind of chew on that toothbrush, and it really got them used to that feeling of having those bristles or something in their mouth. 9 times out of 10, they'd then shoot it across the room and throw it, and then you just pop them in the dishwasher, clean it off, and I had several of these going so the child would get used to having something in their mouth that resembled that toothbrush.
So really, we're going to go into the next ways of how can we prevent caries. So let's go one by one, Stacey, and I'll have you start.
All right. So fluoride. We all know about fluoride. We've heard about fluoride. There's fluoride in our toothpaste. When you go to the dental office, you can have a fluoride treatment done. Now, I remember back in the day, fluoride treatments that were this big goopy tray that you had to keep in your mouth with either a foam or a gel, and it felt like it was for hours in your mouth when it was really only a minute or 4 minutes back when it was the gel, and that fluoride was there to protect your teeth. Now we have fluoride varnish, which is great, and you can see this being applied to the child's teeth. You can also use this on adults. We were talking about those root cavities. This is a great way to put fluoride on that root surface. This actually hardens to the tooth. It's kind of sticky, feels a little funny on the teeth, but bam, you paint it on, It doesn't taste horrible. It's not in your mouth for over a minute. It releases that fluoride over an extended period of time, and it's so much easier than those trays used to be, and it gives the patient a much better application of fluoride. And like I said, it's great for adults, because as an adult, the thought of having to put a tray with the foam or the gel would be horrible, and I'd be like, no, I don't want to have that done. Whereas this, I can go to the dentist, they can put this on my root surfaces to help protect them, and I'm getting a really good dose of fluoride.
Sealants. Ooh, sealants are nice because oftentimes we think of sealants just being applied to children, but sealants are beneficial for all ages. If you kind of feel with your tongue on your back molars, and I know Stacy tried to do this yesterday while speaking, it's really hard to do.
It was very hard.
So feel your back tongue, your back molars with your tongue. You'll feel these really deep grooves in your teeth. And what happens is those grooves are great. They help us kind of chew that yummy steak that we love to have, or that kind of really tenacious food. But what those grooves actually are also causing is a valley for the bacteria to pool in. And it's actually sometimes those valleys are so deep that even our small toothbrush bristles cannot remove that bacteria. So what the sealant does is it just fills in the valley a little bit, so that way the bacteria doesn't have such a low point to go to, and the bacteria then can kind of be really easily removed off of the tooth with your toothbrush. So you can see in this image, the whiter area is that sealant.
And the great thing about a sealant is there's no drilling, no Novocaine needed. It's the same thing. The tooth, this is applied to the tooth, a light is shown on that, and it adheres to the tooth that way, filling in those valleys and grooves that are there.
Yes, and sealants studies show that if you have sealants on your teeth, it reduces your chances of developing a cavity on a neighboring tooth, because we are generally reducing the amount of bacteria in the mouth since it can't stay in that area.
So I was a little click happy and got the healthy diet slide up there first. And we have all heard that an apple a day keeps the doctor away, but the apple a day can also keep the dentist away. So how is that possible, Krista?
Right. So apples and carrots is another example. They're really kind of crunchy foods, and apples and carrots can, just like your toothbrush, help to remove that plaque off of the tooth surface so it doesn't stick there to have a potential to cause a cavity.
Another good thing about our diet is we know that a healthy diet is going to help our body, and there are certain things that we should and should not eat, certain foods that may cause inflammation. We talk about inflammation wherever it happens in the body, it can also happen in your mouth and your gums. So inflammation is inflammation, and a lot of people are affected by that inflammation. So choosing a diet that is going to help reduce some of that inflammation is also going to be helpful for your teeth and your gums. So good oral hygiene. We always are thinking of brushing and flossing, doing things to keep the teeth and the gums clean and healthy. Toothbrushing can be with a regular toothbrush or an electric toothbrush. That's going to give you a much better it's going to hit more areas. It can do more things with the bristles than you can do with a regular toothbrush. We talk about flossing, but if flossing is not your thing, whether it's due to dexterity or, gee, I can't seem to get that between my teeth, anything that you can use to clean between your teeth. There are some great new products out there. One of the things that I love is called a soft pick. It looks like a little rubberized toothpick, and you can get that between your teeth to get out any debris. It sort of massages the gums a little bit. So you want to be cleaning not only the tongue side, the cheek side, and the biting surfaces of your teeth, but you want to be cleaning in between those teeth with either floss, a soft pick, Proxa brush.
There's so many things out there, and if you are having difficulty with what you're currently using, I suggest that you speak with your dental hygienist or dental professional, because they may have another option for you. So even if you hate flossing, okay, well, let's figure out another way to clean it in between your teeth then.
And they may also have samples for you to try too, because I don't know about you guys, but if you stand in that dental aisle of Target or Walmart, there are so many products that you may not even know what to choose or to start with, and always going to your dental provider is a great place to start.
And last but certainly not least, regular dental visits. We don't want to just wait till there's pain. You can see we actually maybe don't ever need to get to a point of pain, especially with regular dental visits, and really utilizing some of these preventive caries to prevent tooth decay.
So we've been talking about tooth decay and bacteria. We were saying, brushing the plaque off the teeth and the bacteria. And it's important to know that it's not just the bacteria that is going to cause that cavity. It's the bacteria in the presence of refined carbohydrates, or we often just kind of lump that all together and say sugar, that is going to create this acid, which then can destroy the tooth. Want to explain a little bit more about that for me, Krista?
Sure. So whenever we place something in our mouth, our saliva is trying to break that down. It's actually, our saliva is the first line of defense for our digestion in the body. But what happens is when our saliva is breaking down that food or that carbohydrate or even that drink that we're placing in our mouth, it's causing this acid. And it's the acid that is really causing the cavity or the potential to cause a cavity. And if I use myself as an example, it took me about an hour to finish my coffee this morning between getting ready and taking care of my son.
Did you have sugar in the coffee, though?
Whether or not I had sugar in the coffee does not matter. It's still my saliva really breaking that coffee down every time I place it in my mouth. So what's happening is because it took me an hour, it means my mouth was susceptible to developing a cavity, not just for that hour, but for an hour and a half. Because after I took that last sip of coffee, it takes my mouth 30 minutes to get back to this neutral pH where it's happy and no cavity can be developed. So we're not asking you to change your diets. We're just asking you to be mindful of that, especially if you are cavity prone. If I'm cavity prone, then I want to make sure maybe I'm having my meal and then waiting a set period of time before placing something else in my mouth, and that I'm not constantly sipping on something like a coffee throughout the day.
That brings up a really good point. I had patients that would come in and say, oh, yes, every day I have this giant iced coffee and I have it at my desk and it has sugar in it. And she happened to have a lot of root cavities and we couldn't figure out what was going on until we had this conversation. And I'm like, okay, well, have you tried it without sugar? Have you tried it with a sugar substitute? No, I'm going to drink that all day. I'm like, okay, well, you can't do this because, like Krista said, every time she was taking a sip, it was taking her body 30 minutes to dissipate that acid. And if she's taking a sip, 15 minutes taking another sip, 15 minutes taking another sip, you can see how that is, instead of compounding interest that we like to get on our money in the bank, you're having compounding acid attacks, which is not really good because then your mouth is constantly bathed in that acid and not getting back to that neutral pH. So we talk about bacteria plus those carbohydrates and the acid attack for 30 minutes, but there's also acidic foods and things that we eat and drink, which can also affect our teeth. As you can see here, we have that sort of pH curve, and 7 is in a neutral, which is our water. So the lower the pH that an item is that you're either eating or drinking, the worse it is for your teeth. Now, that doesn't mean that you can't have your orange juice in the morning. You just don't want to be sipping on that orange juice over a long period of time. If you have your orange juice, part of your breakfast, and move on, you're going to lessen that acid attack. And oftentimes people say, hey, I'm just going to drink that diet soda or maybe that seltzer water. And those things do have an acid in it, and they have a lower pH, which can affect your teeth. So even though something's sugar-free, we do have to be mindful about the acid that is in the products that we're eating and drinking. And I'm looking, I think 2 is the coffee or the soda? Soda. 5 is the coffee. Oh, so I'm better off having a coffee than a soda, it looks like, Krista.
And quiz time, next one. If you were to eat 10 jelly beans, Stacy, what is the best way to eat them to lower your risk for developing a cavity? Eat 1 every hour for 10 hours. Eat 2 every 2 hours for 5 hours. Eat 5 in the morning and 5 at night, or eat them all at once.
I got to think about this one because, see, I think, the jelly beans are sticky. They have a lot of sugar. And based on what we were just talking about, I think that I'm going to want to eat them all at once. Well, that didn't sign up at the check mark didn't line up at the right thing. So I want to eat them all at once. As we were saying that if you're going to have something that's either acidy, sugary, or breaking down into that sugar, have it at once, minimize that amount of acid attack, and that's going to be better off for your teeth. Although it might be fun to sort of have them every 5 or 10 minutes, better to eat them all at once.
Perfect. Our next topic today is periodontal disease, and this next image shows a myth and then the fact. The myth is that oftentimes we hear, oh, I'm getting older and that's why I have gum disease. But the fact is, it's not part of getting older of you having gum disease. You can control it, and it does not have to be a part of getting older.
And I think that speaks to what we were talking about earlier, how a lot of adults are keeping their teeth longer. I think, you know, my parents' generation, it was just sort of something that happened. They lost their teeth, whether it was to decay or periodontal disease. I don't think they really understood. It was just part of growing up, and like, oh, I lost a tooth here, I lost a tooth there. And this slide is showing us the different stages of gum disease. And you can see by the pictures that picture one is a nice, healthy tooth. The structure here is the bone is surrounding the tooth. The gums are nice and pink, and they're nice and high up towards that crown or the part of the tooth that you can see above the gum line. We get into gingivitis is the second stage, and that's where you're going to have that plaque and sometimes that hard tartar or calculus that the dental professional needs to take off your teeth. Those are stuck to the tooth, and you can see here that it's irritating the gums. The gum tissue is a little red, the tooth is irritated, and the gums are inflamed. This is reversible. That's good to know. We remove all of this stuff, we're going to get back to our nice, healthy teeth and gums. Then we move into periodontitis, and you can see here where that bacteria has affected or destroyed the bone tissue. You know, bacteria wants to feed on something, or like an infection is going to irritate something in your mouth. This infection is affecting your bone. So unlike a cold, which you might get a sinus infection or a runny nose or some congestion, this periodontal infection due to the bacteria is destroying the bone, which is going to maybe loosen up that tooth. You might start to have some pain and you have some redness and infection. And then when we get more advanced, you can see where more bone has been destroyed and the tissue is really red and irritated. And this is where you could be in danger of losing that tooth.
So going back to the stages, we're going to focus on the first stage of periodontal disease, and we call that gingivitis. And gingivitis means the gum is inflamed, so your gum tissue is becoming inflamed. We can see on the image on the left-hand side that we have some plaque in the area, or maybe it's our body sending out those immune responses causing this inflammation. Our body's trying to get rid of that irritation that's there. And so we, as a consumer, as an individual, want to make sure we're doing our job at home to remove that plaque so we can get rid of the inflammation and our body does not have to do it. And also, once we can remove the inflammatory factors such as that plaque, we can see on the right-hand side, we can really kind of reverse that red inflamed tissue to this really nice pink tissue that's flat against the tooth surface. So we can see that this gingivitis is reversible and we can get to a stage of having healthy gums again.
And I've often seen this with patients as well as my own children, particularly when they had braces or orthodontic treatment. There's lots of areas where that plaque is getting stuck and it's hard for them to clean. And once that they know that they need to clean above the brackets, if they have that red and irritated gum tissue, their gums will get back to this pink area, which is really good for you to see because you can see those changes for yourself.
The next stage of gum disease is periodontitis, and this is where we don't reverse that inflammation of the gums. And then now what our body is doing is our body really wants to get rid of the bacteria in the area, so it sends all of those antibodies to the area. And because the bacteria has now started to affect the bone, it's actually our body who is taking away the bone that supports the teeth because it's trying to take away the bacteria that's in the bone. So once we lose bone, this is not reversible. In dentistry, there is no way currently to bring back bone to an area. Now, if you are an individual or know an individual who does have periodontitis and they've lost bone around the teeth, that's okay. Don't get discouraged by it. Know now that we want to address the issue so we don't get more bone loss in the area. So we can't regrow bone. Don't panic. Let's just figure it out so we don't continue to lose more bone.
So that's really good to know that, you know, once you get to this stage, it doesn't necessarily, you're just going to let it keep progressing to losing that tooth. You know, you don't have to accept that you're going to lose that tooth. You can stop that progression and get those areas to stabilize and therefore not lose that tooth. Which brings us into, the complications of untreated gum disease. We talked about complications earlier of just untreated oral diseases. Well, now specifically with untreated gum disease, one of the first complications is, losing that tooth. That's a real thing, that you can lose a tooth based on that periodontal disease or gum disease. And one of the things that we have to be concerned with when you lose a tooth is what's going to happen to that space. Teeth like to have teeth next to them, so even if it's a back tooth, the tooth on either side may slowly start to dip in and move into that space, or that space is going to close, and that happens over a long period of time, but that's a complication. If it's a lower tooth that you lose, the tooth above it also likes to have contact or something to bite against. So that upper tooth may slowly start to hyper erupt or kind of come down to filling that space. The root surface is going to be exposed. You may be more prone to getting a root cavity on that root surface. So losing a tooth is a real issue, and it can cause complications. Granted, now there are great ways to replace the missing tooth, but let's not get to that point. Let's stop things before they get worse. We mentioned earlier that there's a link between, a relationship between diabetes and periodontal disease. There's also been research that shows relationships between cardiovascular disease and stroke and periodontal disease. And since Krista, again, recently had a child, tell us a little bit about the relationship between pregnancy and gum disease.
Sure. So the relationship between pregnancy and gum disease, because there's inflammation happening in the rest of our body doesn't know, oh, hey, there's inflammation happening in our mouth, or hey, there's inflammation happening in our toe, or there's inflammation happening in growing a baby. So our body's trying to now go to the infection in our toe, the infection in the mouth, and in growing the baby, and we don't get necessarily more antibodies with all of that. So what happens is our body sends out the antibodies it has to try to help to fight those infections, and what happens is unfortunately sometimes we just can't fight the infection as well when we have other infections happening. Also, the hormones through pregnancy can also cause some inflammation in the gums. You could be the best toothbrusher and plaque remover with your floss, but those hormones can also disrupt that. And it could be that your hormones occur all the way through you stop breastfeeding.
And that's right. I remember seeing patients that were pregnant, and all of a sudden they'd say, like, why are my gums bleeding? Why are my gums irritated? And it was a real condition called pregnancy gingivitis. And like you said, sometimes that will go away after the baby's born, or maybe after you're done breastfeeding, particularly if that patient does have really good home care with the brushing, the flossing, or cleaning in between their teeth. It can be just related to having that pregnancy going on. So let's talk a little bit about tobacco and periodontal disease. Smokers are 6 times more likely to have bone loss. I'm messing that up. So yes, smokers have 6 times more bone loss from periodontal disease than non-smokers. So if you're smoking, you are at greater risk for having bone loss from that periodontal disease. And a lot of it is due to the heat and the chemicals from smoking that can cause tissue damage. That sort of makes a lot of sense to me, is that, here you are putting something really hot into your mouth, and it's going to change that tissue that's in your mouth. Think about if you've ever burnt your finger on either the curling iron or the stove or a hot pot, and what that happens to your tissues, you sometimes get either a blister, or even if it doesn't get to a blister, that tissue sort of changes and your body has to start healing. And it takes a long time for that to heal. Well, think about if you were smoking and that was constantly going on in your mouth. The oral tissue in your mouth is going to have that not really burn, it's not really going to be burned, but it's changing that tissue, and it makes it harder for the gums to heal. So if you have periodontal disease, or even if you have a tooth extracted, things are going to take a lot longer to heal in your mouth if you're a smoker. And there's also a rise on oral cancer. So chewing tobacco, smoking, all those things contribute to oral cancer, stomach cancer, and cancers of the throat. It's a real issue out there that these things are on the rise.
And I think this is our last quiz, Stacy, so let's make it a good one. What is the single most important thing you can do to reduce your risk of periodontal disease? A, brush and floss every day. B, use Listerine. C, if you smoke, quit. Or D, chew xylitol gum.
I'm going to say if you smoke, you should quit, because we just talked about how someone that's smoking is going to be at 6 times more risk to have bone loss from that periodontal disease.
And I think it's important to note on this slide that all of these things are important. They all are going to help reduce your risk of periodontal disease. But if you are smoking, quitting is the single most important thing you can do to reduce your risk.
That's a good point. We don't want to say, hey, if you smoke, then you're good. You don't have to do any of these other things to reduce your risk of periodontal disease, because it's not, with anything, it's not a one and done. There's always multiple things that you can be doing to reduce your risk of caries and periodontal disease.
So our next topic is oral cancer, and we've touched on this briefly already with the tobacco use. But in general, oral cancer, as Stacey had mentioned, is on the rise due to those other products that we are seeing being used, such as the chewed tobacco or maybe the vaping. Oral cancer accounts for roughly 2% of all cancers diagnosed annually in the United States, which is
that doesn't sound like a lot.
Right. I was just going to say it is a low percentage, but what is scary about oral cancer is this next bullet point. Approximately 48,000 people are diagnosed with oral cancer each year, and this part is the what's scary part. Only slightly more than half will be alive in 5 years. So what happens is that oral cancer metastasizes very quickly in the mouth, and oftentimes when it's diagnosed, it's already diagnosed at a later stage. So it's oral cancer, once again, very difficult to spot in the mouth. It's really a dental professional who can spot it the best in its early stages. So going back to, if you have no teeth at all, it's still important to visit the dentist. We are, as dental professionals, assessing more than just looking at the teeth for a cavity or periodontal disease.
And you're right. I was at the dentist again. Like I said today, I was there this morning. And, you know, for those of you that have been to the dentist and you wonder, why are they pulling on my tongue? Or why are they making me say, ah? What are they doing? They're kind of moving my cheeks all around and looking before they, you know, go ahead and start removing that plaque and bacteria. They're doing that sort of oral cancer screening. They're looking in those places that cancer has been known to start, to see if there's anything that looks different, funny, or if there's any changes. So anytime they're making you pull your tongue and look around, that's exactly what they're doing.
And the last point here is that an increase in oral cancers in younger adults or children even is related to the human papillomavirus, so HPV, which is a sexually transmitted disease.
Prevention. As dental hygienists, Krista and I are always teaching prevention. Also being part of Northeast Delta Dental, we teach prevention, or we preach prevention, because we know that prevention is going to pay off in the long run. We have a great program. It's our Health Through Oral Wellness program, which is focused on prevention. The analogy I like to use is, think about your car. You want to maintain your car. You want to do things to prevent things from happening with your car. So you take your car to have the oil changed every, 10,000 miles, 15,000 miles, whatever your mechanic is recommending. And you do that to prevent engine problems, to prevent things from happening to the car. So just like we want to have that prevention for our car, we want to have prevention for periodontal disease and caries, the two things that we're really talking about today. Our Health Through Oral Wellness program is an enhanced preventive benefit program for our subscribers of Northeast Delta Dental. We use a risk assessment, which is PreViser, and the dental office is going to use that risk assessment to identify what your risk is for caries and periodontal disease.
So you can see in this example here, the patient's going to the dental office. They have Northeast Delta Dental for their dental benefit plan. The dental office does a risk assessment for the patient, and if the patient is shown to be at risk for developing periodontal disease and or caries, then the patient has more preventive benefits that will now be covered under their plan. So we like to think of ourselves as the HOW program, as the patient smile coach.
So some of those preventive benefits might be things that we talked about earlier, the fluoride treatments, the sealants, visiting the dentist, maybe visiting the dentist more frequently is one of those benefits, so you can go in more often.
Exactly. And I always like to talk about what also is the patient benefit to having a risk assessment completed. Of course, yes, if you have Northeast Delta Dental with the HOW program attached to the plan, you will receive more preventive benefits to be covered. But I also like to think of this risk assessment as giving you a score. And throughout our whole life, we are used to being graded. So this is almost like an easily understandable grade that we get on our oral health.
Would this be like maybe my BMI or my credit score, something that is like a number that I can understand?
Exactly. The number goes from 1 to 5. 1 is a very low risk, 5 is a very high risk. So we want to be on the lower end, and ideally we want to be a 1. So if all of a sudden I go to the dental office and I'm a 5 at the highest possible risk for developing tooth decay in the future, that alerts me to say, well, I don't want to be a 5. How can I get down to a 1? And then I can engage the dental hygienist or dental professional to give me ways to get my scores to lower.
It certainly sounds like it would make things a lot easier. I know that when I was working in private practice, having this tool was beneficial because it wasn't just me subjectively saying, you know, you need to brush and floss because your gums are bleeding, they're red or irritated, by telling them you're a 4 out of 5 risk and this is what you can do to make that risk lower, really made the patients understand. And I think it helped me explain things a little better too.
Definitely. And we hear how many dental offices across Maine, New Hampshire, and Vermont are using PreViser. We started our HOW program January 1st of 2015, so it was just starting to get out in the field what PreViser was, what this risk assessment tool was. But as we are now in year 4 of our HOW program, which requires the PreViser risk assessment, we can see almost 90% of dental practices across Maine, New Hampshire, and Vermont are utilizing and have downloaded this free software to use on their patients.
And I think a lot of them, too, are not just using it on their Northeast Delta Dental patients, which you talked about earlier, that the risk assessment can really be used for all of your patients to have them have a better understanding of that patient risk.
Perfect. Thank you, Stacy, for clarifying that.
So this next slide, oral apathy. See, we're trying to prevent oral apathy today with this webinar and explaining the, importance of your oral health and why you should be, seeking oral care. And oral apathy is that lack of interest or enthusiasm or concern relating to the mouth. And I think there's a lot of people out there that still have that. And, big deal, like I started earlier. What's the big deal? It's just my teeth. Or, oh, it's just a baby tooth. There's no big deal. But you can see here from a study that was done by Delta Dental that the consumers or the patients, as well as their employers, both believe that preventive care is valuable and a cost-effective way to prevent the higher cost of dental treatments. So even though somewhere in the back of your head you might be like, what's the big deal? I think we do understand both on the patient side as well as the employee side that, preventive care is valuable and it is going to help reduce those higher costs of dental treatment and also provide better outcomes, because I would much rather have a sealant on my tooth than wait to have a cavity or maybe even a crown down the road. So I would rather have those simpler, easier treatments than have something that's a big and involved procedure.
And so the single most important thing we want you to take away today is the importance of preventive care and seeking preventive care from your dentist. Your dentist's role is not just to treat, it's actually to intercept the disease with these preventive methods before they need to treat with a more definitive method like a filling, where they're removing tooth structure to place a filling there. We don't want to remove anything. We want to have you go on with what you're born with throughout the rest of your life. It's also important for you as a patient, as an individual, to become engaged in your oral health and to ask questions so you understand where your current oral health status is and how you can improve it. And as I mentioned earlier, intercepting disease before it occurs in the mouth. You can have your risk assessment completed by your dental professional, and your dental professional can take your score and really individualize your preventive treatment plan with things like the fluoride treatment or the sealant, or maybe doing something like a nutritional counseling in the dental office that can really talk to you about foods you're eating that can reduce the inflammation.
I really like the fact that you can that care or the treatments are really individualized. It's not like sort of, the car wash where everyone's getting their car wash the same way. You can really have those individualized treatments for your patients.
So go ahead, Stacey, take it away with the summary.
Summary, we've talked about, obviously home care is valuable to your oral health, the brushing, the flossing, cleaning between those teeth. We talked about avoiding sugary or those high carbohydrates or acidic foods, or if we're going to have them, what's the best way to be consuming them. We learned that, if we're smoking, it's a good idea to try to quit or reduce our smoking because that's going to help lower our risk of periodontal disease, and going to the dentist regularly for that preventive care. Always, seeking out your dental professional for those personalized recommendations and treatments are best. We can give you our experiences, but we are not looking in your mouth and we're not able to give you that individualized care. So visit your dentist. They are the oral prevention specialists, and they're going to help design a treatment plan that is best for you.
Thank you, Stacey, and thanks for your help today. I want to also thank Sharon and Caitlin, who have asked us to present on this important topic of your oral health, and I am going to turn it back to Caitlin, who is going to field any questions that you may have. So thank you all for having us.
Thank you, Krista and Stacey, for that wonderful presentation. I hope we all go brush our teeth after this. I know I will. I do have a couple of questions here for you, and if anyone else has questions, feel free to, again, type them into the chat feature, or you can also raise your hand if you hit a little hand button, and I can unmute you as well. So the two questions I have so far is, I think going to the dentist has a lot of stereotypes, and a lot of people don't like going to the dentist. I've known people who've never gone to the dentist, which is a little scary to think, but how do you encourage people to go to the dentist if they've either had a bad experience or they just don't want to? What are some tips you can give?
That's a really great question. And actually, people are fearful of the dentist, even in this day and age. And I think if someone is concerned or fearful or having anxiety about going to the dentist, the best thing is to talk to the dental provider. Even if it's not going in for that appointment, like, okay, I'm going to go in and get my teeth cleaned, setting up a time, can I have a few minutes to come in and talk to either the dentist or the hygienist? I think talking to the hygienist is key. If there's more than one hygienist in the office, you might click with one over the other, explaining your anxiety, explaining, gee, I haven't been for a long time, and this is why, maybe explaining that you've had a bad experience. I've had lots of patients over the years that have come in and said, I really don't like being here, and they're really apprehensive, and we kind of say, okay, well, why? What's going on? Or we're going to take it slow today. Maybe we'll only do this much of the appointment. Do you mind coming back if it takes longer? On an extreme end, sometimes, the dentist will maybe provide an anti-anxiety drug for that person to come in. And again, that's sort of the extreme end, because then they need to have a ride to bring them in, things like that. I think the biggest thing is just communicating. We, as dental providers, don't know what you're thinking and feeling unless you let us know that, and most of them are open to it. I mean, what's your experience been with fearful patients?
Exactly. I don't have anything more to add as far as how I would treat a fearful patient, as Stacey mentioned, but from a consumer side, I can speak to this example with my sister-in-law. My sister-in-law went to 3 dental practices before finding a dental practice that worked for her. So each dental professional has maybe a little bit of a different bedside manner, and so finding the dental professional that works best with you is what you want to find, and it may take a couple tries to get there. And of course, that's not the best, because as an anxious patient, we're already having a hard time getting there, but just know that there's light at the end of the tunnel always. So speak to your friends, speak to your family that live in your area, and see how they like their dental professionals, how those bedside manners are, to see if it's the right fit for you. And if you do discuss your concerns with your dental office and dental hygienist, and they're not meeting your needs, you are not stuck to going to just that practice. So find the right practice for you. So Caitlin, I hope that helped to answer the question about the dental anxiety and getting to the dental office. I'm not sure if there's been a follow-up question on that while we were speaking, or if we want to go to the next question.
Yeah, no, I think that's a wonderful answer. Thank you for that. Our next question is, a lot of employers, especially large employers, have kind of an internal wellness program, but they're often not focused on or mention anything about oral health. So how do you think employers with wellness programs, and maybe those who don't have one yet but are looking into starting one, how can they get oral health within their programming, or what are ways they can encourage good oral health within the workplace?
Sure. We're actually working with a lot of the employer groups with Northeast Delta Dental to develop that challenge to help them get oral wellness in the workplace. Some of the ideas we have come up with is to have the patient take a self-risk assessment and then logging in that self-assessment as a challenge. And therefore, they're entered either into a raffle contest or they develop points in their wellness system. Also, having the patient go to the dental office, asking for a risk assessment to be completed, and then just showing that that employee did have the risk assessment completed. And the employee doesn't have to show their score. All of that can still remain confidential, but just once again showing that the dental office has done this for them. We know other employer groups who offer points or offer incentives if the individual or the employee can show that they went to the dental office to have a preventive visit completed. And then last but not least, we are doing individual challenges within the workplace. So maybe you go a month with brushing every day, twice a day, along with flossing, and you're doing kind of a check off that the employee has done that, and then the employee is showing you proof with that at the end of the month.
Yeah, we really have been doing a little bit more, and we did some research, and you're right, there's not a lot of things out there in whether it's a wellness organization or a wellness website that have oral health into it. So I think hopefully that's going to be changing. And like you said, there's great programs out there that we've been doing. The points thing for going to a dental visit is really simple. I know a lot of employer groups that sort of do that, and they offer that incentive. So at least they're getting that foot in the door for the preventive visit. We've also done things like, reducing the sugar, or doing a little activity where you can measure out how much sugar is in the things that you might be eating and drinking. Saliva pH test, you can get the litmus test paper off of Amazon, and people can test their saliva to see what their pH is. That's really fun after somebody's had coffee, because that will affect their pH. So there are some things out there. I think as a company, we're trying to work on some of those things as the demand
increases.
Yeah.
Great. Next question here says, I work with adults who only have main care and cannot afford paying for dental care. Any suggestions on how getting help with the cost?
That's a great question. I would suggest reaching out to something like the Maine Oral Health Coalition, who would have options of maybe income-based clinics throughout Maine, or may have options, especially maybe if it's a veteran. The veteran, I know oftentimes on Veterans Day, there's free dental care for veterans. So there are several programs out there in each individual state. Unfortunately, I don't have the list in front of me for the programs in Maine, but I know something like the Maine Oral Health Coalition could certainly have that list for them.
And it is a struggle. I think main care gives that one visit, and it's a year maybe, or maybe it's even longer. And I do know that in the legislature, I think in Maine and New Hampshire, that there are groups that are looking to sort of advance a better adult coverage benefit for main care and Medicare. So I think there's a lot of talk about it, so it's a really timely question. Unfortunately, we don't really have a good solution, or here, go to this one location to help those patients.
Great. Well, thank you for that. This is Caitlin. I just want to mention that UNE does have a dental clinic. They have a dental school in Portland. So I think that's an option for some people. I don't personally know much about it, but for those who might be low income and can't afford too much dental care, I believe UNE will take for learning for the students, they do dental care as well. So that's always an option.
Yeah, you're right. UNE both has the dental school and the dental hygiene school, and both of those schools within UNE have a dental clinic that offer very low cost care.
And for dental hygiene alone, there's also University of Maine Bangor has a dental hygiene clinic as well.
Great. Well, I believe that is all the questions we've got. If anyone has any follow-up questions, Krista and Stacy, how can they reach you?
We didn't even put our contact information on here.
They can reach us through the extension of 1339. So the best number for us would be 603-223-1339.
Great. Well, thank you both for a wonderful presentation. I hope we all learned quite a bit on how to better take care of our teeth and our mouth today. So I want to thank you again, Stacy and Krista, for presenting, and just let everyone know that this recording will be posted on the website. So if you want to come back for reference, or if you want to send your employees the link to the webinar as well for them to get more information about oral health, certainly this will be available on the public website in about a week or so. So thank you all again, and enjoy the rest of the day.